Hello,
Okay.
this is Group 1, and we're going to be presenting Cedars-Sinai Medical Center incident.
All right. So we're going to start with how it started. So back in 2009, Cedars-Sinai Medical Center, located in Los Angeles, California, was alerted to a problem with its CT scanners when a patient reported that they had hair loss after their scan, which prompted an investigation that exposed a serious problem with the radiation dosage given to the patients. This investigation led to the discovery that over 200 patients received an extensive amount of radiation for a CT brain perfusion scan than normal. So let's get into it. So what happened? So what actually happened in August of 2009, a stroke patient reported that their hair was coming out in patches, which obviously is not normal. So the California Department of Public Health, which I will shorten it to CDPH, and also the Federal Food and Drug Administration was alerted to the situation. The CDPH, because it's part of their scope to look into things that affect the public, and also the FDA, because they not only regulate food and drugs, but they also regulate medical devices and radiation emitting products. So what they found, the CDPH sent a state radiology inspector to look into the matter. And what they found was that since they initiated a new protocol into the GE CT scanners back in February of 2008, every patient that had a CT brain perfusion scan done, they were reading an enormous amount of radiation dosage. No other CT scans were affected. It was just the CT brain perfusion scan that was affected. So for 18 months, this situation went unnoticed. So the blame got passed around to the CT techs that should be watching those numbers, to the hospital that set those new scanning protocols in place without properly ensuring the parameters were set, to GE for their CT machines not having multiple backups and fail-safes in place. Either which way, regardless, lots of patients were being unnecessarily exposed to large amounts of radiation. 40% of which experienced that hair loss, and others experienced skin reddening. So we might not ever see the stochastic consequences that the median age sorry, we might not ever see the stochastic consequences considering that the median age of the stroke patient is 70 years of age. So that they are more likely to die of other causes first than whatever this radiation is going to cause. So, what this investigation also led to was a discovery that another hospital, the Glendale Adventist Medical Center, also encountered the same issue with the GE CT brain perfusion exam. They found that about 10 patients, since the new scanning protocol was put in place, were receiving about 3 to 4 times the normal radiation dose.
And as for dose rates, the recommended dose limit for the public is 1 millisievert per year. A CT head scan, on average, exposes the patient to 2 millisieverts. So the patients involved in the incident were exposed to approximately 16 millisieverts in a single day. And previously in the class, we had talked about the fact that it is amusing that some doctors don't know the doses that are involved in the exams that they order. But this is taking it to a whole other level because it was pure negligence from the technologists because they simply did not care.
So for the early effects from from the effects from the radiation from this incident, it caused the early stages of ours, which is acute radiation syndrome. And usually people who are exposed to over a milligram of radiation, these people were exposed to 8 to 10 times more than that, and which is actually a lot. So for the stochastic and the deterministic terms. So for the effects from radiation, the deterministic effects would be the skin burns and radiation sickness from those who are directly affected. The incident also raised concerns about patient safety protocols and the need for more quality control in the medical equipment, even though some people were saying that it was the tech themselves who were just not paying attention and doing it. Some people were fighting them and arguing with them, saying it was the scanner itself and how they were not getting it checked regularly or doing their quality control. Or you know how you guys do your QAs every morning, and I guess they weren't keeping up with that. But how Stephanie was saying also for the stochastic effects, the patients or the people who were affected from it were a lot older. So we might not be hearing or getting any information if they're going to get affected. But some stuff that could happen is increased cancer risk. They were saying that psychological distress among their patient and families could also have an impact on them as well as healthcare institutions. And this incident also prompted regulatory reviews and changes in operational practices at medical facilities to prevent similar occurrences that happen in the future.
With things like the modality like CT, it doesn't typically use a large amount of dose compared to like X-rays or MRIs, I believe. So it already uses a low radiation dose, but in order to, keep that going, um, protecting using a large protects the technologist and the patient and the medical staff. It also aids in the quality control, like Sasha said, if they were to check that regularly, it'll ensure the stability and protection on the hospital themselves and overall create a better quality image and increase or decreases the amount of repeats that one would have to do. And it also lowers your chances of all the effects that were mentioned earlier. How Alara is utilized in CT, it'll just be like using it in X-rays, so ensuring the patient's correctly positioned and everything. Sometimes the patient can be immobilized, so they'll just lay there crooked. So it's up to you to really fix them and put that into your responsibility there. And just limit their scanning field, sort of like collimating to the area of interest to avoid overexposure and the risk of having to repeat exams and things like that.
And what we can learn from this is to never stop caring. We will be conducting the same exams over and over again, but even if some of them share similarities, we have to treat each case as a different case, meaning that we should always attempt to give the best care possible to each patient. They are trusting us to help them heal, not to harm them. And we should always practice the principle of Alara on every patient every day to protect them and to protect us.